Hello and welcome to Dialogue. I'm Joey in Beijing. Thanks to rapid technological advances in recent years, the global smart healthcare market is expected to witness lucrative growth. As one of the most populated countries in the world, how can China best develop smart medicine? How will technological progress help solve China's healthcare problems? And in what ways will smart medicine change our lives? To talk about these and more, I'm happy to be joined in the studio by Professor Li Mengtao from the Department of Rheumatology at Peking Union Medical College Hospital and Dr. Xiao Fei, CEO of Changzheng Syncate Pharmaceutical Corp. But before we get started, let's take a look at this.
Taking out your smartphone and getting medical service wherever you are, whenever you need it. Smart healthcare technologies have already made it a reality. Internet Hospital connects doctors, patients and pharmacies in a community, providing patients with hospital bookings, remote diagnosis and treatment, a digital prescription service and online medicine purchasing. Against the backdrop of innovation fever in China and the public's desperate need for healthcare reform, more internet giants like Alibaba have started to explore the new industry. However, the Internet Hospital is just part of smart healthcare. Big data and the Internet of Things are the two other pillars. The combination harnesses the power of two huge technologies, wearable devices that collect data and cloud computing technology to analyze all that data in order to put it to use. In China, medical resources are in short supply and their allocation is extremely unbalanced, with 70% located in cities. Meanwhile, the demand for healthcare is further accelerated by the aging population and the anticipated baby boom stimulated by the two-child policy. The healthcare market is huge in China and many challenges remain. Smart healthcare is widely expected to be a key solution to the nation's medical problems.
So today we're talking about China's healthcare industry and how will smart medicine change this. Let's first talk about where are we now? What is your evaluation of China's healthcare system at this moment? Some people divide it into two parts. The previous 30 years, we have universal healthcare, and now is pretty much everybody on his own.
I think that the situation of Chinese healthcare is the similar situation with other countries, because for the human being, for the patients, their demands is yearly and minute need, and so from time to time we will think about how to improve that. But not everyone will satisfy with the healthcare at any time.
Actually, look back to our China development. Actually, China used to be a country with a limited resource and cover the whole population for this universal, so-called universal healthcare. Actually, Chairman Mao is established this new China. And so he targeted this universal health care. And by that time, China was extremely poor and just went through this early developments and everywhere need money. But actually, China have this primary care system established, and in countryside have barefoot doctor. That's only a group of people graduate from middle school, get some basic knowledge, and clean the wound, and work in the commune, and help vaccinize, give vaccine.
They were not very professionally trained,
That's
but they
right.
provide very basic
Very basic health care. And for the, this commune, and each commune, it's this working unit, have this small clinic or hospital. They can do is do appendectomy and some very small surgery. And so this barefoot doctor can bring those peasants or farmer to the commune hospital. And if the commune doctor, maybe just graduated from some training program and can do some the primary treatment to their this village farmer, and then they can refer some complicated case to the county hospital. Because this county hospital can do colonectomy, and but if county doctor was trained, graduate from medical school, they cannot handle the situation like hepatoma, and so they can refer those patients to provincial hospital. So layer by layer, tier by tier, and have this primary health care system established in the city, and each factory have this factory nurse or doctor. And if some accident happened, they take care, and if they cannot handle, they send to their working unit in the hospital, like a rural.
It seems with market reform, this kind of a institutional arrangement has been in kind of a shock. Now, it cannot adapt to the new market economy because the medical resources has congregated in the top level. At the grassroots level, is very insufficient. How can we make, what kind of reforms we can make the system work better for those people living at the bottom?
I think that's the topic we talk about.
Yeah.
Yeah, we call it the smart medicine, or I usually like to call it, it's like the data. We will share the medical data, because for our patients, it's a general population. They will have a disease for a long time, and the medical data is very important for the diagnosis and the treatment. But in China, by now, even in a big city, in a big hospital, so where's the medical data? It's only in the hospital, but it's hard to be shared. So that's the problem.
So you mentioned one aspect of smart medicine. Will smart medicine, that will cover a lot of areas.
Yeah.
For example, big data, internet-based hospitals, smart devices, artificial intelligence. Do you think technology will change the industry of healthcare once for all?
No, I think that's the incremental, step by step. I actually look back past 30 years as we start this market-driven medical care or healthcare system and follow almost a United States style. We have several tiers, and especially in major cities like Dr. Lee's hospital, Uni Hospital, and the patient have to line up in early morning to register. So I think in China we have a hospital, and the patient always complain that's very difficult to see the doctor. It's very expensive. However, when we review the whole system, and everybody can see Dr. Lee if they get up early, line up.
Because of the technological change?
No, that's because the system just set up like everybody can line up, and then no matter what their condition, probably he just see a patient just want to do a consultation or do a confirmation from other doctors' opinion and waste his time. So that's the problem of our current healthcare system. So they're too easy to see doctor or go to the major hospital without primary care, and cause this problem. So system itself causes a problem.
Do you agree, Professor Lee, because of the scarcity of excellent medical resources like your hospital and doctors like you, the distribution is a problem? By establishing a primary care, we can make the system work more efficiently?
Yes, I believe. I think that the concept and the direction is correct, because how we can distribute our experience and I think the technology can help us.
What kind of technology are you referring to?
Because I already emphasized the data.
Big data is one thing. Yes.
Yes, big data.
Sharing the patient's data with all hospitals. So tell me, what is the problem? I know that when I go to a hospital, my medical record is actually stored in that hospital's computer. I think it is very easy to connect the databases of all hospitals into a gigantic system nationwide. What is keeping you from doing that?
Right now, each hospital, so-called the public hospital, they run as an enterprise. You know, each hospital may have their
So they want
own
to keep their information secret rather than sharing with
That's
others.
right, one part. The other part is they have a different system. Because some use IBM, some use Oracle.
That's technological
a technology barrier. And also, you know, there's a hospital kind of suspicious to expose the data because a lot of dispute on, you know, those details. Plus, if patient left the hospital, there's no follow-up data. So that's the major problem. We don't know the outcome of the patients. Like two-thirds, as I know, Dr. Lee can confirm on this data, two-thirds of patients went to Union Hospital for for diagnosis or treatment. That's not Beijingese. And after they've been diagnosed and the doctor prescribed these medicines to them, they just lost. There's no data after they left the hospital. So that's another issue. So technology may solve this problem or assist this problem solving.
So both doctors and professionals agree that this kind of technology like big data can help improve health care. And the patients also recognize this. What can hospitals, governments, pharmaceutical companies do together to help establish such a system? Who should take the lead? Do you think there is also privacy concern, information of their health records?
Privacy is not a big issue in China. You see the patients, when they get a disease like a tumor or like a rheumatoid arthritis, they call around the family member and the friends and try
privacy
to.
is not the top concern.
No, not just education. We have done a trial because Dr. Lee and his team is working on this largest hospital-based data collection and biologic sample collections, and we try to connect to his system, do the follow-up data collection, and we have already worked on more than 400 hospitals and 700 rheumatologists, and then educate patients, let them know data is important, and develop this app.
What is the government stance on this? The health ministry, they support it?
Yes.
Only morally or institutionally?
I report our protocol to the central governments. That's called the Family Planning and Public Health Administration.
Yep.
They support this trial, and because the way is our medical system never follow up the outcome, not outcome driven. That's only volume driven. So that's the problem. So we try to educate patients, let the patient change their role from passenger to co-pilot, and learn the knowledge and manage themselves.
And you believe they can also become a pushing force for the government to be more proactive in adopting such a
Yes, from reactive to proactive. And so after education, we found 86% of patients can handle their data entry. You know, doctors, nurse, very busy. It's hard to entry the data. And so the patients can do that, educate, or family member can do that. We form a community, and then they collaborate on data entry, and they do self-evaluation on disease activity. All the data synchronized with the doctor's terminal. So we did this, the methodology validation. We show 86% of patients can master this technology, simple. They all have smartphone. And then we did a cross-section study. We found we could reach to target effective rate that's 34%.
So in essence, they can master the technology and they can use them to their own
That's
advantage.
Right. Yeah. After using this technology repeatedly, we found after 5-time evaluation, monthly evaluation, the effective rate reached up to 80%, from 34%.
All right. Thank you very much. We'll talk more about how smart medicine will change health industry later on in this edition of Dialogue. Don't go away. Oh, let's continue our talks on smart medicine. You mentioned one thing that is big data. With big data, actually, we can create electronic health record for each and everybody, and that will make the practice of medicine more effective. Professor Lee, is that the future of medicine? Because everybody will look at the record of their whole life's problems, what drugs they've taken, what the treatment they've been through, and that will make your diagnosis and treatment even better.
Yes, I believe that, because you know, and for the international countries, they just do that and try to save the problem for years, like the states. And the government encouraged to set this kind of medical record, but
they also run into problems.
Yes, they also have the problem. Our government also encouraged we could have this the health care for the people, the general people. Then, if the people have some disease, they will have a medical record. So, the medical record with high technology will be our future.
Why big data is so important for medical care? With more data means you have more knowledge about a single patient or a disease. How would it help your practice, your profession?
Because the disease is very complicated. When we to take care of patients, we'll think about not only the gender, the age, their history, maybe the environment, and a lot of information is very complicated. So if we have this kind of data, so we already have the background of patients. If the patient already have a very definite diagnosis, and the treatment plan and response outcome
will be better.
So, will be better. And when we can give a decision and to benefit our patients.
What about the problem that we raised in the beginning of the program? Will it solve the problem of redistribution of excellent quality medical care resources? Can machines take over some of the medical jobs that humans are doing?
I'm sure that, because right now, just like we did a survey, and on 300 professors and clinicians, and they give us the answer that in their clinic, close to half of the patients don't need to see them inpatient, and they can solve the problem through the other way, like email, like a phone call, like a one answer, like a consultation. And so that's really...
For technologies.
Yeah, we can use the technology. Actually, MGH, that's the Massachusetts General Hospital, they did a study. 3/4 of the patients, 75% of American patients doesn't need to stop by clinic. They can use the other way. This telemedicine stuff to solve the problem.
Do we still have to rely on humans to do the pre-selecting? Which patient go to where?
That's right now we cannot avoid that. So we are talking about this follow-up patient, because like in China, the patients stop by clinic, see Dr. Lee at first time, he make the diagnosis and the treatment regimen ready, let them go home, and then they come back a month later, same questions, and continue the treatment, and maybe just answer some simple question. Okay, continue that treatment, because he evaluated patients, get a better result, and continue this regimen going. But they line up for half day and see Dr. Lee and have a 5 minutes conversation.
You're saying this is not necessary?
That's not necessary. And so the platform technology can set up. All we tried is to set up platform after doctor made the diagnosis, made this treatment regimen, let them go, and then they can link through internet, mobile phone, and the patients do self-evaluation, entry the lab test and the medication, and then data synchronized.
But let's push this a little further. If this is the case, can doctor do this in a remote way, like we just discussed? They don't have to travel at all, even for the first diagnosis. Can people wear a device and let the doctors see and diagnose a patient from a distance?
Some disease like dermatology, like
dermatology,
rash. Some like dermatology, and the doctor can send the pictures over, and the eye doctor, they give this picture for the fundus of the eye, and so that they
still different diseases of different
that's right.
requirement for information.
Yeah, for the internal medicine, even for my specialty, rheumatology, and the very important thing is the history. So we can remotely.
So that's why data is so important. Really.
Yeah, we can remotely to not face to patient, but we also can collect the value information for the diagnosis.
The Chinese medicine has a huge challenge in how to modernize their practice because their practice basically is based on patient-doctor contact. The doctor has to see the patient, feel the patient, touch the patient, and ask a lot of questions. Do you think Chinese medicine can be modernized in a modern world with technologies like we've been talking about?
Actually, I can give you an example.
Or
they have
stay primitive. As
yes, they start to develop a special, camera, and because traditional Chinese medicine need to read this tongue, so they can take pictures and match different conditions and give diagnosis, follow Chinese medicines, system to give some advice. So that's possible. And also this like a palpation and like listening, like observation, that's all can solved through this technology device. And but the whole serologic, this series system, the system that different from modern Western medicine. And if we observe this history of traditional medicine development, actually 2,000 years ago, they all originated from the same observation from our forefather. But Western medicine go to the evidence-based and the lab test-based, and our traditional Chinese medicine inherit from family education type of, inherit from this use nature herb stuff. So we have to integrate some theory, like Chinese traditional medicine theory, wisdom actually lead the world. Like our old Chinese traditional Chinese doctor educate me, like see different disease in different way, see the same disease in different way. That means very much not modern concept. Like a precision medicine, we have to reclassify disease. Actually, we see the patient with rheumatoid arthritis.
So it seems that you're suggesting the advancement of technology has also changed the profession of medical professionals as well. As a medical professional, where do you think healthcare industry is developing in 10 years and 20 years' time? What is the major breakthrough that will happen that will be a game changer of your profession?
Actually, I think there's no only one technology revolution can make healthcare system revolution happen, but that's integrate. Like in the past we have the experience like antibiotics. Everybody think this infectious disease is gone, and the chemotherapy will cure the cancer.
MIR.
That's right. MIR can make all the tissue
we can see the inside
observe.
of the human body. Those kind of technology are game changers.
Yeah, game changer. And for the diagnosis, however, like human genome, and everybody expect too much. However, that's incremental develop. So I'm sure this we should get a paradigm shift from the old one to the new one. Like right now, we should change our paradigm from volume-driven to outcome-driven, and also we should change our paradigm from this treating the disease or heal the patients. We should use our care. Go back to the ancient time. Doctors should not only depend on the machine and use their care. I have a lot of story talk about that. Like if patients get good advice from doctor said, okay, that's a new medicine, very effective on your disease, very confident. That's what we call the positive placebo effect. That's even you take a sugar pill, you can get 25% of the effect. But if doctor neglect patients and said, okay, that's the drug you can try, maybe get 25% less effect. So and go back to the original, we have to recover, this medical professionalist. That's the one part. The other part, we should change our paradigm from treating the disease, find the nature of disease, like we treat tumor. In old days, we use chemotherapy, we use antibody, monoclonal antibody. Nowadays, you see this in the world. They change the paradigm, build up patient self immune ability. This anti-PD-1, CTRT. This kind of the co-stimulators. This release the brake of our immune ability to anti-tumor. This match our traditional Chinese medicine concept. This is the 扶正祛邪, build up the positive energy against the enemy. So you see, this paradigm shift may be lead to the future revolution and combined with new technology, IT.
But those paradigm shifts comes from the change of mindset.
Okay. Mindset. That's we see the whole world as different. So we have to change the mindset. That may lead next revolution of the healthcare and how to see the patient, how to see the disease, how to see the health. So,
all right. Thank you very much, Dr. Li, and thank you, Mr. Xiao, for your takes on this question. And you've been watching Dialogue on CCTV News. Thanks for joining us. Goodbye for now.